still talking minimal there.
So she's just kind of like flat.
It's pretty flat. Yeah.
Yep.
Okay, normal height is on the left side.
Pelvic level.
Yep.
Nothing.
She was an interesting one to start with, kind of my first assessment.
Yeah.
It's like pretty small, pretty like. I was down there where like being too rough. And
Knee position.
Where was
neutral,
the?
good.
Where did you just mark on there? With the pelvis. So it
right
looks
there.
like. Oh.
So this would be excessive hike or excessive height, and this would be flat.
She's got the normal, so but you still marked something.
Because it's expected to see about 1.5 inches of offset from anterior to posterior in the orientation of the PSIS to ASIS.
Right.
oh,
And
I
then
see.
where
So
does
you're
this
saying
come
this
from?
is normal.
Yes. Yeah.
Right.
This is hip hike.
So if she was, I see. If they were
Okay.
even, then that would be
Flat.
flat and not
Correct. Or if
expected.
she was yammed, like hammered into hip hike, or if there was like a 2.5.
Right.
She was like
She's like
way
that. Gotcha.
big. Yeah.
Okay.
Yep.
Okay. So,
And then Julie, this right here is assessing pelvic height from a posterior point,
Okay.
not the orientation of the ASIs to
Okay.
PSIs.
You
Because
marked
these,
that earlier.
weirdly enough, these could be different, right? You could see
Right.
this and that, which
Both, yeah,
so
both the
you know,
emotion-
both
excessive.
neutral, but then
Oh, neutral.
Yeah.
then you know the orientation is, I mean, that's massively hiked still. So you can also see like stuff like this where that may not read much of a hip hike difference, but more of a
tilt.
tilt. Yep,
Right.
exactly. So what we're seeing here, she's hiked, and then we'll find out.
Okay,
know,
but you
next.
already put that height arrow in.
Correct.
That was
when
from
we
the
when we were assessing
posterior.
from a posterior standpoint. Yep.
Gotcha.
Yep. Exactly.
Right.
TKE
Haven't done
limit.
the left side, so I see. Right.
Yep.
Okay.
We've only
sorry,
done.
the
Yeah. Yep.
left side.
TKE. Thoracic rotation. Oh, weird. Okay.
Right, this is what we were noticing, how she felt like she was the opposite, but that's because her head was right.
Yeah. This is weird. This is I've never liked seeing that. T-spine rotation left.
Why didn't you like seeing
Shoulders.
that?
What's that?
Why didn't you like seeing that?
It's just weird. It's not a traditional pattern that you see.
I see.
So like her spine is hammered this way, her shoulder is like down, and I mean try to put yourself in that position, man. Her
Okay.
spine's rotated, her shoulders down and forward and up and backward here.
Yeah, I don't
Like
like it.
rotate your spine left.
Left.
Push your left shoulder down.
Yep.
Don't move your spine now.
Okay.
Now push it forward.
Okay.
Now pull this shoulder up and pull it back,
Yeah, that's
and then get your head straight forward.
So she's
That's
like
her.
left.
That's her neutral configuration.
right.
It's mind blowing to me sometimes to think about that. What's up? Like my neck hurts. No,
Yeah.
doing that. What were you saying? She's what?
So her shoulders are opposite the way her
Yeah.
spine is rotated.
Yep.
And then you're like,
From what
okay.
we've seen. at
So you
least.
take all of this down, and then you're like, how do I even start?
Well, yeah. I mean, yeah.
You just start.
You just start winging again. So she's winging on both sides there. I think I like that better. That's gonna work better for us. Yeah.
Cool. Right
Maybe,
there.
maybe we put a P and an R down here.
What's that mean?
Protracted,
Pro-
retracted. I like the arrows though because it gives the client a visual representation and they need to
What
see.
they're doing. Yeah.
Yeah, but for us, I don't know. see. It's getting kind of wordy there, but maybe we just need the tip and the wing. I don't think we need the P and the R. Would you agree with that?
Yep.
Yeah.
Okay.
I think it's nice to have two things that are separate, or that are close together, like two different things. Like one's an arrow, one's
Yeah.
represented by a word
Yep.
thing. That way,
Yep.
it's like.
And the protraction retraction gives us a better idea of like directionality of the system too. Like her body's trying to drive her one way with the shoulder. Yeah. Okay. We were kind of in a bit of a discussion about this
Yeah.
lordosis on one side, I think, or bilaterally.
Kind of.
Was it the lordosis that we were kind of talking about? Like you were like, I'm not seeing it too much.
Yeah. I mean, at first I didn't see it, but then when
After
you
getting her,
put her a little bit, I was like, okay, yeah, she's a little bit limited.
And then we definitely saw that upon kind of looking at the cervical system, that was definitely normal. I'm not sure what I was seeing there initially, but that was not anything good. Okay. Was her tipping more on this side? No, about the same. Okay.
That's an interesting thing.
I know, right? Because of the shoulder position.
Yeah, and also like.
What are you thinking there?
I was just thinking about that, like the lordosis and kyphosis thing. And I wonder if back musculature adds to that. How I thought she was pretty flat backed, and maybe she doesn't have that much muscle back there, and so.
True. Yeah. Stiff. We're going, is it left or right? Oh, I think we started there. We started on that side, that's why.
Can I turn your thing on?
Yes, please. Oh, we should turn the heater on too.
How do I do that?
Do you want to walk? There's a heater thing out there. You can just press that button up. Okay, so then we have capital. So let me start down here. Why not? Here we go. I'm not used to seeing it this big. So
Yeah.
okay, 88, 87, 80, 85.
Is this supine now?
Mm-hmm. Yep. We have 88. I need to put a UMB there. 88. And then ASIS.
Did that fall? No. Yes. Okay, so that was then. We noticed that her right leg was longer.
Yep.
When she was standing, it also was.
Yeah, and supine. Yep.
Well, that's good.
Yep.
It's consistent.
87 and 80. Cool. P flexed 2. Hip hike left. Ooh, weird. Wait, that's wrong, huh?
Huh.
No, I
Interesting.
wrote that wrong
You did.
for sure. Yeah. Yeah, I wrote that wrong.
Okay.
We felt that the whole time.
Mm-hmm.
Right. It was high left.
I can't remember.
Her hip? Or her leg was shorter? Or, I'm sorry, what do you...
Yeah, hip hike. Yeah. No, for sure.
Here's the pictures. We could look at the picture.
Yeah, good. We need to make our thing anyway.
We really can have a sense of what we're.
Scoping out here,
Yeah.
huh?
Are you guys gonna process this for you tomorrow?
Yep. He'll be doing
2 to 3?
2 to
Your
3
guys'
report
time?
findings. Yep. And I don't know if I've showed you this before, but like this is how we build this out, and then you drop it in here. So You go like that. Oops, nope. We want that one. And then what I like to do is I'll do front facing, and then side, side, back facing.
You have that in like a little
It's an
collageable thing?
Yeah, it's like a little appy thing. Make your pictures a little bit bigger.
What is it called? If I still have the app.
I think it's called
Pic collage.
yeah, I think that's it. She's a very small person. There we go. And then you just go save.
Adorable.
She is. And then copy.
Little jeans, jiggings. Or
She's
whatever.
like a little country farm lady.
Hard worker.
She wants to work hard.
Well, maybe she always, or she did.
Yeah,
she's
she
always like,
wants-
I used to
she-
do all this farm work, and now I don't do any of that.
Yeah, she wants to get back to it.
So she always had scoliosis.
I think she definitely called it. So
She's
and then
had it
you
like
can
a
just
bunch,
paste
yeah.
it in there.
It's like,
So now it's in our
System.
system. There we go. So yeah, let's check this out just to. Uh-oh.
Right hip hike.
It is right hip hike.
I mean, her shirt's up on that side, but it's not hard to tell.
Looks like right hip hike. Okay. We'll trust it. I'll make a note to check it tomorrow.
Yeah,
Too.
that's what I say.
Yeah, it's simple. Okay, so make a note. Check that. Blue means check,
Okay.
just for key stuff.
Yeah.
Like
Yeah.
future.
Check, recheck, check this again, check it out. So if that's the case, that means that she flip-flopped
Huh.
on the table. So with supine posture, we're using red and kind of the maroony red because I
Yeah,
use the
then
bright
green.
red. Yep,
Right.
you got it. Okay, trunk lateral flexion, T-flex. Trunk lateral flexion right. Go. Knee flex left. Starting to see some stuff on that left side, huh? The left knee. GH abduction. Bilaterally abducted. So I'm going to check this one. If it's the same, you check it. If it's different, you can create another arrow. That means, yep, saw that twice. GH abduction, check. Shoulder protracted, left on the clavicle side, check, but it's the clavicle. Must not have seen that. So I would have dashed the, or were you taking notes here, or did I take notes? Yeah.
Yeah, we
Dash,
should
dash.
dash it.
So this is her supine on the table.
Yes, correct. Yep.
And so now you're seeing some differences in the clavicle, but you
Yep.
didn't see that standing.
Was I taking notes or were you taking notes, man?
You were taking notes for some, and
On bone.
I've
This
done
looks
that
like
as well.
you.
But maybe I jumped. Yeah, I probably jumped it. Yeah, I probably took that part.
Oh, we started and then you started and I was
Yeah.
like, actually, let
You
me
were-
just hammer this.
Yeah,
Yeah.
you were talking to her.
There we go. Shoulder depressed. Okay, so we have shoulder depression left. Oh, whoops. Oh, come on. Let me get in there. Okay, we have a rib cage flare. And then this would be if it was like high or low. We would do like high or low there.
If it's a flare.
So if it's a flare.
Oh, I see. A flare versus the
Yep.
rib cage actual. Okay,
Yep.
got it.
Yep, and then this would be rib cage is higher, rib cage is lower, which we didn't see that. Yeah,
We didn't see any difference. We just saw flare versus that.
Yeah, so I think you don't have to write anything there. Shoulder elevated right, check. Seeing the same thing there. Clavicle elevated right. Okay. I guess we didn't see any clavicle depression there. Cervical lateral flexion right. Was it slight? We saw that super slight. Minimal. If it was a big, if I'm like, oh my gosh, she is pinned, I would have done something bigger like that. Right? Or, it would have been something more significant. But
Right.
that's not what we saw there, just a little bit of bend there. Cervical neutral, okay, and then cap, we had cap flex. And we had lateral flexion left. So that's the head right there. So what we're seeing is that her neck is right, her head is left, and slightly tucked there. So that's what we're seeing. Which means that's going to close her out over here. So if she's here, and then here, and here. So maybe she's having some nerve impingement stuff going on. Maybe we can start playing with that thing. So check, cap, position, and then our hypothesis is left cap, right cap, flex, plus lat, flex, right. So we'll explore that, see what's going on there. That might be a good entry point without overstressing our system, but we could maybe do some unkinking of the hose if that goes in our favor. And it's not a big movement. It's not like we're hammering on her neck a ton. It's just this kind of nice subtle chin movement. Okay, good.
So her head and her neck are opposite each other.
Yes, yep.
Doing
You can
different
kinda
things.
See it here.
Yep.
You can see it more now, right? That her neck is going this way. Can you see that?
Yeah.
See how it's like, and then her head's like. She's like laying like this. It's like this.
Yeah. Yeah.
Yeah. So that could also be a reaction to her spine on the table too. Table force reactions. So let's actually do that. Let's go. Table force reaction. Write that down so I know what I'm talking about.
Shoot, I gotta
Yeah, man. Yep. We're actually, I mean, we're
close. Yeah,
pretty
we're
happy.
not
It's not crazy, and I'll text her tonight and get the report, or text her later and get the report findings. Okay, there. Good. No pain. IWR. Low quality. Low quality. Low quality. Whoa. Low quality. Low quality. We kept going, huh?
We just, cause it was kind of like at first it wasn't.
Oh, that's right. Yeah. Cramp. No pain there. No pain. So were you writing these, or was you wrote those, huh? It doesn't look like my handwriting there. Yeah. So in this situation, I would also
check pain.
Yeah, just so because you can see. I mean, obviously you're writing pain there, which I can. There's you can infer that there's no pain there, but just to go, no question about it, no pain, check. On the daily note, I have a box at the very end in case you don't if you don't check the pain, that you can just check no pain at all on the SARS.
Gotcha.
And so that's another way to do it. But in this one, we don't have that in here. So
gotcha.
Okay, cool. Boom. Pain with elbow flexion. Okay.
So just in the like, this is what we're gonna be doing.
Yep.
How do you feel pain? Oh my gosh.
So we're putting that in here. And in the sagittal plane, I also use that maroony, and then with the pain, we do the light red again.
Mm-hmm.
Pain with Q. Okay, cool. Let's see what we got here. Tib rotation, bilateral, left.
Both sides couldn't. She couldn't rotate her.
Yeah, I didn't mean bilateral. Yeah. And then with the comp patterns.
So one was like external rotation, one was internal.
Yep. And then we had internal rotation, hip IR comp. So I'd write CM hip IR. So compensatory motion, hip internal rotation. Yep. And then anterior tib.
That was both sides. So
The
when she was
anterior.
trying to do her tib on her left foot, her right hip was still rotating in.
Wait, say it again.
Are you saying the comp pattern for both was just one? Oh, okay.
Comp
just the
pattern,
right, just
yep.
the right. Okay, that makes sense.
Wait, left.
When her left leg was rotating.
So when we were assessing 30 degrees knee flex, tib IR,
internal rotation.
her left hip was internally rotating as she tried to internally rotate her tibia. So it was like, when I'm saying hip, I'm talking the femoral acetabular junction, not the pelvis, right?
Yeah. Okay.
Is that, or were you thinking differently there, like it was the pelvis or the femur?
No, I was thinking the
Femur, okay, cool, yeah. So yeah, this thing, she was doing that.
Right, I got you.
So basically, it's kind of interesting. She's thinking that she's tibially internally rotating because she's seeing her foot move.
Yeah, but it's really.
But it's her.
Yeah.
Gotcha. Nice.
And then on the external rotation, she had
anterior tib pain.
Okay, but no compensation.
Right.
That you noted.
Yep.
Okay.
Okay, and then supine. Let's see.
Yeah,
you got roll, huh?
Yeah.
Okay.
All right, cool. Good.
Feel
Good
better.
stuff. Yeah, thank you.
Yeah. So I'll just. I mean, I think there's literally like 10 of these, man.
Okay.
So
I could even. Oh, I'll be here tomorrow. We'll be here on Thursday. Tomorrow.
Oh,
like
cool.
At 12, so we can just
nice.
catch up if you have any time.
Yeah. Let's see. I think you.
But if not, we'll.
Yeah. Well, I'll share this with you, so you can have.
Okay, perfect.
Yeah, and
That's
then you
fine,
can just
yeah.
check it out tonight, and I don't know. Maybe we can hop on 20 or 30 minutes tonight and process if you want to, like on a Zoom. if you want to do
Good,
that.
that's good. Yeah, I'm planning on just like my
Like-
last thing's at 4:30. I'm just gonna go home.
Okay, I'm off at 6:30 or
Okay,
something
cool.
like
Yeah.
that. I mean, dude, this is gonna take us
Okay, sweet.
10, 15 minutes to do, other than explaining stuff. But yeah,
All
cool.
right.
Because you're
Sounds
just
good.
putting down